Which aims can be reached by the Tomatis Therapy and where are the limits?
Yes, well, that is a very broad question. The aims are, in fact, to improve the total well-being of a person. That has to do with, in principle, with the neurological system in persons, so the physical and psychological aspects. So many disorders can be treated in that way, which have to do with the brain. So there are many possibilities. So the aim is an improvement of the total well-being, whatever it may be. We can come to details later. So what are the limits? The limits are, of course, personal. Each person has its own limit. So that can be different for each person. So it's difficult to say what are the limits. In fact, there are no limits to start with, but one has to find out how far we can reach to improve a particular problem in a particular person.
The Tomatis Therapy has a holistic approach. Is it because of this that you can treat a lot of problems and diseases through the stimulation of the brain?
Yes, the holistic approach, I would say, is a vague term. It's not very clear what one means. It is a broad approach, I would say. And it has to do because the method of Tomatis is basically neurophysiological. So it is a training. It is not a medical health care method, but it is a training of the neurophysiological system. And so it has to do with the coordination between the two hemispheres of the brain. So all the diseases that are related to the neurological and physiological system of our functioning, and that has to do with the brain, and in particular the coordination between the two hemispheres, that can be treated with the Tomatis method.
How does the Tomatis listening training help people in everyday life?
It helps in everyday life because it always would stimulate our brain, in particular the cortex, so we would always benefit from a stimulation. And I can give you a personal example. My wife and myself, we listen with our method many times ourselves. And recently my wife and I, we also both got heart problems. I got particular heart surgery, 4 bypasses. And immediately when I was at home after hospitalization, after I think it was 2 weeks in total, then I started also the Tomatis method on myself, and that made me not necessary to make use of psychological assistance. No, I feel myself great, psychological and also physical, because I do also training. So in everyday life you always are stimulated and you have a better feeling.
Is it even possible that a trauma disappears totally because of the listening training? Is that possible?
That depends very much on the person, on the problem, the depth of the problem. I would say in many cases we do not reach the total disappearance of the problem, but we certainly observe in most cases a significant improvement. That depends on the way we perform the therapy. It depends also on the way the person stands in the therapy, and do they continue the therapy as we would like them to continue. So I would say we can assure in many cases significant improvement. Disappearance depends on the depth and on the person.
Is the Tomatis therapy even able to damage somehow?
I would say that is quite impossible, because we work with music on the ear, and when the therapy is executed by a well-trained person, a well-trained therapist by our training center in Sint-Truiden, for instance, and the certified institutes related to Sint-Truiden, then I would say it is impossible to cause any damage.
But can there be a kind of abuse or misuse that can happen by using the Tomatis therapy?
Well, I would like to repeat, when it is in the hands of a proper licensed center by Sint-Truiden, by a licensed therapy, this is impossible.
In which field of diseases or problems that people have does the Tomatis listening training achieve the best success?
Well, I already explained that the therapy is dedicated to all those problems which have to do with the brain, particularly the neurophysiological system that is trained, and particularly the coordination between the two brains. So that is not a mystical therapy. You can scientifically prove that you train the cortex particularly, and the coordination between the two hemispheres, and therefore the great success areas are those of learning disabilities for children, functioning problems of children, dyslexia, dyscalculus, autism also, and in general dysfunctioning of the person.
Science is developing and it goes on. But is there a progress improving the results of the Tomatis therapy or the Tomatis listening training? Are there measuring data?
Yes, fortunately, at Sint-Truiden in Belgium, one has started many years ago, I think it's more than 10 years ago, that in collaboration with neurologists, one has introduced brain mapping. That is quantitative EEG, electroencephalogram measurements, so one can measure before, during and after the therapy the activity of the brain. That is an independent method, independent of the Tomatis method. And one has observed data which prove that there is particular change in the brain, which also is accompanied with a positive result on the listening test of the Tomatis therapy. So the data are there, and they are published also, particularly in the Journal of Neurotherapy.
Are there other therapies that cooperate very well with the Tomatis therapy?
Yes, I should say in the field of learning disabilities, collaboration with remedial teaching on schools, and also with speech problems with logopedists. There is a good collaboration. In fact, we have proven in our collaboration in our center with logopedists that they like to have the children to have the Tomatis therapy first, and after that they are much faster with their logopedists methods.
There exists a kind of catchword in the Tomatis therapy. It's the mother's voice. And it seems to be like a magic word. Can you describe, please, why it is so important?
Well, there is nothing magic about it. As a scientist, I'm very much interested in the scientific experiments, and it has been proven also by Tomatis that the ear of the fetus during pregnancy has been completely developed after about 4.5 months pregnancy. So the fetus does hear the external noises through the mother, particularly by the bone conduction of the mother. So when the mother is singing and speaking to the child, this is very fruitful to the child. Now, why do we use now the mother voice during the therapy? Because this is a resemblance of the experience of the fetus. So psychoanalytical, one could say that when we apply the mother voice, we go back psychologically to the fetus time, and returning to this time, out of the fetus time, we may pass our frustration, our dysfunctioning during the development, our traumas sometimes, and so they can be cured in a psychological way. So it is a psychological training.
How does the listening training act on widespread diseases like tinnitus, for example?
Okay, you mentioned tinnitus, and Tomatis always told us tinnitus is one of the problems which are most difficult to treat. However, we see in many cases improvement or even a total success. But it is indeed, as Tomatis said, difficult. The origin of tinnitus in the medical world is also not very clear. So one tries with chemicals and medicine, not successful in most cases. Therefore they come to the Tomatis method. And why does it work for tinnitus, for example? Well, we think that with the listening therapy we do not particularly focus on the tinnitus, that is one tone at high frequencies normally. We do not focus on that one tone, but we improve the total curve. So if you have the total listening curve improved, the tone which is hurting you is becoming relatively weaker, so relatively less important. So that's why we think it works. And in some cases it might disappear, but then we simply have luck.
And how does the therapy works at burnout, for example?
Yes, burnout is also in this society a common problem with people who work too hard or whatever. I would say burnout is basically a psychological disorder, but it has also physical problems to come with it. So therefore we work with burnout with a normal therapy. It goes through the normal procedures with us. We improve the listening, but we focus on the psychological problems. That is to say that through the improvement and the stimulation of the cortex, we improve the psychological well-being, and we see an improvement in the burnout problem.
And what about stress? In English?
Stress is also a word that is related to psychological problems. It has to do with tension, psychological tension, but also tension in the body. And our programs are different from burnout in the sense that we focus more on the quietness of music, the quietness of the adjustment of the apparatus, so that we can relieve the tension in the psychological well-being and the tension in the body.
Okay. And we have a disease, Meniere, you know it. Why does the Tomatis therapy works there? How do we act in the therapy? What does we do there?
Yes, Meniere, Tomatis has written lots about the ear and also the illness of Meniere. He has a particular theory about it, that the Meniere may be caused by the own vibration by the oval window and makes sound in the cochlea, and therefore one experiences something that is artificial. So it is an artificial experience, particularly exciting the equilibrium organs. So there is an equilibrium problem, and therefore Meniere makes the people sometimes quite sick. And the treatment is to treat the ear, to get rest to the oval window, to make the ear have quietness. So a quiet program is very useful, and we have to avoid the very high tones with Meniere. We may slowly go to high tones and stop at 4000 Hertz and later go to the full 6000. So Meniere can be treated, but it is also a difficult problem which needs time.
There are different groups of people that have a very special benefit from the therapy. For example, like actors, singers and speakers, and people that have to convince with their voices. Why?
Yes, that's a very interesting question. Why singers, speakers, actors, they use their voice, and it is very clear that the voice is controlled by the ear. We speak and we sing by our ear. That is the statement, the law of Tomatis. And how did Tomatis found out? Well, he was born in a family with singers. His father was an opera singer, himself was a good singer, and he treated many singers like Maria Callas, Pavarotti, etc. And he found out when he stimulated the right ear by blocking the left, or the left ear by blocking the right, that when you particularly sing controlled by your right ear, the voice is more harmonic. And so the special benefit of the therapy is that we can adjust the improvement of the right ear with respect to the left ear by changing the equilibrium of the two ears. And so singers, actors and speakers have benefit from this treatment.
Does a singer will get another treatment as a child with dyslexia? Where's the difference?
Yes, dyslexia is quite a different problem from singers. Singers, you focus more on the voice, so more on the right ear. However, you asked the question because dyslexia is mostly related to the dominance of the left ear, that is the right hemisphere, and also for dyslexia we treat the right ear. But for dyslexia we have more, at the later phase of the therapy, a language problem. Language is very important. Reading is then very important for dyslexia, while in the later program of singers we change to music. We let the singers sing with their own voice to bring the improvement permanent.
What kind of treatment does a person get who had a stroke?
Yeah, a stroke is a very difficult and physical problem, so the treatment has to be slow, careful. It is in a stroke such that one has a damage of the brain, and the therapy is aimed at stimulating the brain. So one should stimulate with care. But one provides a normal program with slow filtering to higher tones, and the program takes a long time. Also, low tones are important because in a stroke one has also motorical problems. And the motorical problem has to do with the parietal lobe of the brain, left and right. And so one observes with a stroke that, for instance, the left arm or left limb is disabled, and so one also has to provide a motorical program which is possible with the Tomatis method. So the treatment is one is with slowly high tones for stimulating slowly the brain, and on the other side mixed with a motorical adjustment of the equipment to stimulate the motor performance of the person.
In which age people do get the best benefit of the listening training? Is there a special age, or does it help for everyone?
I should say that the brains are in development the first 20 years of our life, roughly. So during the development of our brain in young time, for youngsters, that is the best time to influence the brain. So for young people, children under age of roughly 20, during the development of the brain, the Tomatis method is very, very effective. After that, it is also effective, but takes a longer time. So the best time is for young people.
Why are the first 12 days so important for the training?
Yes, the first 12 days, we call that the first block of sessions of the listening therapy. It is the longest block, 12 days, for example. That is so important because that is the basis. We need a fundamental basis to build up our listening performance. We have to renew, to re-educate our ear. Our ear has to lose its old performance and get a new performance. And that is done in the first 12 days. And after the 12 days, we can continue the therapy to build on this fundamental basis a new building of new listening and new performance.
There are also some children that refuse to wear the headphones. How is it possible to treat them?
Yes, it is possible. We have the experience that children come into the center and they throw away the headphone and you cannot get it on. One of the possibilities, I think it's only possible in the center in Sint-Truiden, is the so-called night therapy. So the children are sleeping, and when they sleep they get the phone, and then they get during the night the therapy. Why is it working during sleep and during night? Well, Tomatis told all our senses are sleeping except the ear. The ear never sleeps. We always perceive sounds during our sleep. So the night therapy is also effective and the headphone is on the head.
Thanks a lot.
You're most welcome, Anne.
Thanks a lot.